Local and provincial dignitaries were on hand Wednesday afternoon for the official opening of the teaching unit at the Associate Family Physicians Clinic in Swift Current. The project has been in the works for a number of years, and now that it's come to fruition will benefit all parties involved.
In this clinic, we will be doubling the amount of physicians here by doing that, right? So eventually there'll be 8 residents here at a time. That's a large amount of physicians here, and they're able to see patients and provide a service to the community. Not only are they working in our clinic, but they're also working in the hospital with the internal medicine specialists, with the surgeons in the emergency.
It's the distributed model of medical education. It's the opportunity to see our students and our residents come into the different cities in Saskatchewan to receive their training on site, to make connections to the communities, because ideally this will help greatly in the recruitment and the retention of medical personnel, physicians, residents.
And from the province's perspective, the idea of offering the residency program in a rural centre such as Swift Current will benefit the medical community as a whole across Saskatchewan.
Well, I think it's very important that residents get more than just an urban perspective of delivery of healthcare, that they get more of a rural education as well. Practicing here in Swift Current and maybe traveling out to whether it's a Gull Lake or smaller communities to be able to have a well-rounded education, not just in Regina and Saskatoon. The other thing too is we increase the number of residency positions in Saskatoon. They simply can't handle that many residents. You need to draw on the resources from around the province.
Sandy Funk is one of the 4 new physicians embarking on the residency program at the clinic in Swift Current. And although she's only been in the city for a week, she's looking forward to her time here in the Southwest.
In Saskatoon, there's a lot of residents, so you don't always get the exposure that you would like. You're not always necessarily the first-line person to be managing a clinical problem. What I mean is, like, there's always someone that knows more than you. So it's exciting to be here and kind of have an opportunity to be managing things kind of as the first line responder with significant backup and support.
The residency training program in Swift Current is a partnership between the Associate Family Physicians Clinic, the College of Medicine at the University of Saskatchewan, and the Saskatchewan Ministry of Health. A similar program has also been unveiled in the city of Prince Albert.